Good morning, everyone. I'm Lydia Santiago, child psychologist at KSARC. And our guest speaker this morning is Dr. Norbert Ralph, and he's a clinical psychologist, neuropsychologist, and an epidemiologist. He was formerly an associate clinical professor in family practice at the University of California School of Medicine at Davis, and lecturer and research biostatistician in the program in maternal and child health, School of Public Health at the University of California, Berkeley. He is presently a clinical psychologist with the Department of Public Health in San Francisco, working with youth in detention and on probation. And he is the coordinator of the Alienist Panel for the Juvenile Court and coordinates the Juvenile Sexual Responsibility Program. Welcome, Dr. Ralph.
And thank you for the very nice introduction. Let me say it's a real honor to be able to present here. And I hope the title isn't too off-putting. I was looking at it just now and neurodevelopmental perspectives. That sounds like a pretty complicated idea. On a daily basis, I work with youth on probation and a subset of kids who've sexually offended. And in that work, you have to be practical and have to have some idea where you're going with these kids. And I find that the neurodevelopmental perspective, complemented by other approaches, is really a helpful one that helps guide my clinical work and also assessment.
Dr. Ralph, I just want to remind people if they have questions to put them in the chat box and we will track them. And
yes.
At the end, we will manage them.
Thank you for that. I should have mentioned that. Yeah, well, there'll be a question and answer period at the end, and I look forward to your questions. Also, the information presented here is reasonably evidence-based, so the level of evidence varies. Part of my background is look at best practices and evidence-based practices, which is increasingly, we have more information. Also, here's a list of my selected publications relevant to this relevant to this presentation, and they're available at my website. Most of them could be downloaded. So it's an area that I work clinically, but also have been able to do modest research regarding. I want to give you an overview of where we're headed. So several colleagues weren't able to make the presentation, so I emailed them the following. The main point of the presentation is juveniles who sexually offended are usually called generalist offenders, meaning they have many areas of problem behaviors, not just sexual. One key modifiable risk factor, something you can do something about for this behavior, is immaturity and pro-social reasoning that will improve over time, and pro-social counseling methods also could help. Recidivism for this population is low, about 3%, contradicting the stereotype that most of these youth have primarily a compulsive sexual disorder and are fated to reoffend at a high rate. It just doesn't seem to be so based on my clinical work, others' clinical work, and also importantly, the research in the field. So that's kind of an overview of where we're headed. The field has really changed over the years. I came in, I think at about the age of 54 in 2000, doing this work, and the field's changed enormously even since then. Dr. Barbara Bonner is really a leader in the field, and she's director of the National Center on the Sex at the University of Oklahoma. She describes the evolution of this field. In the 1970s, it really wasn't a focus of treatment and kind of the sentiment of boys will be boys. 1980s, and this is after the enactment of child abuse legislation, there was more and mandated reporting, more of a focus, but the initial focus was treating boys who sexually offended as the same as adult sex offenders. 1990s, there was an evolution in recognizing boys are different from adults and need different treatment. 2000s and beyond, boys recognized as having good outcome, low recidivism, There's just some quick facts are that 95% of juveniles who sexually offended are males, and that also 19% have a history of sexual and 18% a history of physical abuse that's well documented. So that's part of the picture, but doesn't define the nearly the majority of these youth. Dr. Barner notes that generally these youth have good outcomes and low recidivisms. Adolescents account for 30% of child sexual abuse. They're distinct from adult population in a whole, adults who sexually offended in a whole variety of ways. They're less compulsive, different motivations, fewer victims, and it's really the behavior is the same, but the motivation and other factors are very different, and particularly developmental, which is the emphasis of this presentation. There's no evidence who sexually offend have a lifelong incurable sexual disorder or paraphilia. This is just a key line. Early adolescence is a high-risk, transitory developmental period for committing illegal sexual behaviors. Dr. Bonner notes that, and we'll go on later to talk about this in more detail. Dr. Bonner notes that most youth can be, of these youth can be safely treated in the community, though a minority will require residential or secure treatment. Decisions about placement should depend on community safety. Pullman and Cito describe that the majority of these youth are generalist offenders, and they don't commit just sexual crimes, but they're youth who happen to commit a sexual offense. So it's interesting that even though these youth have had often a variety of offenses, they often get identified as the term sometimes is used of sex offenders. That's not one that we use because it implies a permanence. But youth who steal cars usually aren't considered having a car disorder. They do many impulsive things, including car theft. So these youth often get defined by the sexual behavior when in fact their behavioral pattern is more diverse than just sexual. Sexual crimes, 15% of arrests of these youth are for forcible rape, 18% of arrests for all other sexual offenses. This is for juveniles. This is FBI crime data. A major study that helped crystallize a lot of our thinking was Caldwell's study, and this is available. If you look for it, you can find it as a download, 2016. He looked at 98 data sets involving over 33,000 individual cases and looked at recidivism regarding youth who'd sexually offended, regarding sexual recidivism and any recidivism. Before, from 1980 to 1995, he found that recidivism was about 10% for this group, but from 2000 to 2010, it dropped to 2.75%, whereas any recidivism remained about total. So a lot of us had been finding that this was the case in terms of low recidivism for this population, but kind of the conventional wisdom is the recidivism was higher. So this, for a lot of us, helped to give us some basis for identifying this population as low recidivism that had significant implications in our assessment work and also treatment. And also for a lot of us got to thinking is, even though this youth's coming through the door for a sexual offense, but if not, any recidivism is that high, about 10 times as high. Shouldn't we be targeting that as well, along with other comorbidities? Um, there's been major influences in the legal field, but also treatment regarding understanding brain development and how that's probation youth generally, um, but also with regard to juveniles who sexually offended. A landmark Supreme Court ruling, Graham versus Florida 2010, points to the major changes in brain development during adolescence, and that major changes happen that are relevant to forensic and criminal issues in the adolescent periods. This type of thinking was important in terms of largely eliminating the death penalty or life imprisonment for juveniles in terms of understanding how crime was related to brain development. A very readable but also well-researched book is by Frances Jensen. She's chair of neurology at University of Pennsylvania, and also a mom. Describes changes in the teenage brain and its relevance for behavior. Age 18 to 25 is a period of major brain development, some of which continues until age 35. She has a great quote she cites at NIMH study, describes that the teen brain is only about 80% mature, and the 20% gap helps explain adolescent impulsiveness. Being civilized adults in part relates to having brain maturity. So when you look at the size of about the brain of about a 10-year-old, it's about the size of an adult brain. But what happens between 10 and 25 is a lot of changes in the micro architecture of the brain. And that's very much connected with a variety of things. You look at statistics regarding accidents, around crimes. You'll find it's very closely associated with age gradients and seems to be connected with brain development. Another book that has a good research basis, Dr. Daniel Siegel. These are things that are available on books on tape. I reviewed both of them while going on my daily walk. He has a wonderful analysis that some others also have described about adolescents systematically overestimate rewards relative to the risk of behaviors. Teens seek out novelty and rewards, and this likely has a genetic or evolutionary basis. The gene pool isn't likely enlarged by males who never venture from home. He also has a concept of what he calls gist, like understanding the gist of things, which I'll use later in this presentation, describing adolescent development in terms of adolescence is behaviorally and psychologically, there's an increase in understanding of the context of a situation that increases slowly during adolescence. And a very practical example for this, if you've ever been to a swimming pool where there are kids and teens and also adults doing lap swimming, adults tend to stay in their lane and don't intrude on the space of others. But teens and kids usually do, and it's usually a matter of herding the kids back out of the swimming lanes. That's just one example of the cognitive map and kids and teens versus adults differs significantly. When you look at brain development and crime, it's very instructive to look at what are called age crime curves for various crimes. Canada does many things well, including crime statistics. They have a national system of crime statistics. And if you look, for example, of theft under $5,000, you'll find the peak age is about 15 and rapidly drops off after that. The little tiny blue curve at the bottom, which you can barely see, sexual offenses. We can blow that up. And its peak age of incidence of persons accused of sexual offenses is age 13 and 14. To me, again, this mirrors or is the basis of what Bonner talks about of early adolescence as being a high risk transitory period for sexual offending. And also in myself and others' view is connected with what's going on in brain development. And you could also look at some other factors like for males, testosterone. This curve almost exactly matches what you see with the development of testosterone in youth too. So it's not A or B, it's usually A and B and another factor C going on. So we have some that crimes and delinquency status might be connected with brain development. And one other angle of looking at that is looking at morals of prosocial or moral judgment in delinquent youth compared to non-delinquent youth. When you do that, and this is a Stams et al. In a meta-analysis of 50 studies, and this has also been replicated subsequently with more recent studies, found an almost large effect size so that measures of moral judgment did seem to differentiate youth who are on probation versus not, while controlling for age, gender, IQ, and SES and ethnic factors. So it's not the only risk factor, it's one risk factor. And it's so important with working with these kids to have a sense of the developmental perspectives. One of the things they also found is that measures that got a sample of the youth's thinking, they used to be called, old school, they used to be called projective measures, but are also called production measures, seem to have a larger effect size. So if you got a really good measure of the youth's thinking, the effect size for moral development seemed to be larger. So one way to look at this research, and this is using area under the curve, is consider you have two adolescents, 16, alike in every way except for their moral or prosocial reasoning. If you pick a youth at random, there's 70% chance with the one with lower moral reasoning will be delinquent. It's a risk factor delinquency, but also importantly, a double risk factor that I'll address later in this presentation. Adolescents with lower levels of prosocial or moral reasoning have a higher likelihood to be on probation. And again, it's not the only thing. Family factors, ethnic factors, ADHD, those are also things that you should be looking at. But this is one important thing to be aware of in treating probation youth generally, and also the subset of youth who sexually offend. Complementary study, and we cited Steinberg before. Steinberg, Kaufman, and Monahan, these are some of these folks are at UC Irvine, and one of their colleagues, Steen, is at UC Berkeley now. Studied 1,300 youth with serious sexual offenses for 7 years after conviction. So they did some interesting things. They found that less than 10% of these general probation youth, not just sexual, became chronic offenders. Even for juveniles who were high frequency offenders at the beginning of the study, the majority stopped offending at age 25. Again, one factor that's hypothesized is brain development and maturity, which also peaks out at age 25. They developed, interestingly, a measure of psychosocial maturity, which included impulse and aggression control, consideration of others, future orientation, personal responsibility, and resistance to peer influences increased through all subgroups through age 25. And it's consistent with brain research, others places in much more detail. And here's the punchline: less mature individuals using this measure were more likely to be persistent offenders, and even high frequency offenders who psychosocially mature were more likely to desist from criminal behaviors. So that's impressive. And again, consistent that they not just looking at epidemiological data, but individual case level. And you would suspect that kids who psychosocially mature would have less crimes, and are actually able to demonstrate that. So when you're looking at the epidemiological or just rates across groups, you can make some guesses of what's really going on with the individual case. And they have a nice little study able to show there is this connection when you get on the case level. So there's reasonable evidence that prosocial maturity, reasoning, is a risk factor for general probation youth. And do we have similar evidence for youth who sexually offended? Well, you would think so. They're a subset of youth who sexually offended. Likely, those studies also included those youth. But we'd want to see if we have any information from studies of youth who sexually offended. This is something actually I was able to do. I developed a measure of production measure called the prosocial reasoning outcomes. And what I actually did was obtained a sample of the youth thinking. And what Siegel describes, similar to what Siegel describes, is just, in my view, of understanding social context of situations, of ends means thinking, and planning ahead. In my view, it was an inexpensive way to measure brain function, and can be viewed as a measure of neuropsychological functioning. Let me say this is still beta, and there's a lot more research I'd like to do with it, but I thought the results were encouraging. This is an example. It was a vignette, has a series of vignettes, and here's a sample of one of the vignettes we present to youth, and then ask them various questions to follow up to try to get a sample of their thinking about the vignette and how they would think it through. So we're trying to get a sample of their thinking with everyday types of dilemmas. And all the dilemmas are basically the same. They talk about how youth are dealing with understanding of social rules and expectations, and how that conflicts with things that are of interest, motivating, and bright and shiny for them, and how the youth deal with those two things and try to solve them. And it's always fascinating to find the creative ways, and I do mean creative ways, kids can think of how to handle some of these dilemmas. And I was also able to develop a reliable scoring method that seemed to have the characteristics of measuring the factor that I was interested in, prosocial reasoning for juveniles who sexually offended. So I was able to look at 3 samples. Again, these are small samples of convenience. First sample, the high level, were youth in a high level program, and for juveniles who sexually offended, their crimes are more serious and a level of problems higher. Then separately looked at a mid-range, also residential program, And we're able to make the distinction between high and medium based on standardized measures, just to let you know. And then also looked at the high school population. What we found is that higher scores meant higher levels of pro-social reasoning. And there was a perfect, when we did the multivariate analysis controlling for age, we all found there was a perfect ordering between the high school to medium to high in terms of decreasing levels of pro-social reasoning. And it seemed to behave like we would think for a measure of pro-social reasoning. Also, it seemed to show that there was a age effect controlling for the program and other factors. Older teens tend to score higher than younger teens, is what you'd hope. Also, we're able to use it in a couple of studies looking at treatment, pro-social treatment interventions. They're relatively short-term, but also looked at use time in total residential treatment. This measure seemed to increase, showing the effects of both focused pro-social treatments and also total time in treatment, which is what you think it would do as a measure of pro-social reasoning. Also, it has measures of pathology. There's something called the JSORAT, which assesses primarily static factors for relating to predicting sexual offending, and then also a total measure of the symptom checklist 90-R. So the measures seem to have these characteristics. So I think we have reasonable evidence that pro-social reasoning is a risk factor for general probation population and for the subset of youth who sexually offend. And again, there's more research to do and methodological limitations with the studies I've been describing. And let me say, these things also do impact the day-to-day treatment and counseling I do with these kids in terms of understanding what I'm about as a clinician and what I'm up to. Also, the issue is if these are modifiable risk factors, what type of treatments are likely to have the greatest influence? Probably the most authoritative study in the field is from Lipsy's 2009 study, where he did a meta-analysis of 548 different samples of youth on probation getting treatment. What he was able to identify is there seemed to be some type of approaches that were effective, and actually some of them were actually harmful. He found the most effective treatments in these were general probation youth or counseling and skill building methods, followed by multiple services. Multiple services would be what we'd usually describe as wraparound justice, and what he described as surveillance. Surveillance kind of boiled down to you had a firm but fair and vigilant probation officer and services tracking the youth. And this seemed to have a beneficial effect. But again, the major ones that are interventions that had skill building and counseling. One of the, and they also looked at by age, gender, or ethnicity did influence the effectiveness. Interventions that were more effective with higher levels of delinquency were more effective with youth with higher levels of delinquency. And that a key thing is that they were more effective if implemented with high fidelity and targeted at appropriate youth. One of the interesting findings is that locally developed programs, sometimes they're referred to as homebrew programs, were equally effective with larger, better known name brand programs. Both could be effective. There was one state, for example, that was mandating that only name brand programs would be used, and they're able to do pushback. Lipsy's group that, hey, some of these smaller ones have good outcomes, and there's a good reason to keep them. Lipsey subsequently looked with a colleague at programs looking at effectiveness of juveniles who sexually offended. Again, it's a wonderful study looking at, there were 8 high-quality outcome studies he identified with juveniles who sexually offended. And what they found was that, that interestingly, these programs didn't seem to be able to demonstrate in sexual offending as a treatment effect, but they did, interestingly, seem to reduce general recidivism, consistent with the statistics we talked about. Interestingly, that they said there may be some methodological things. If recidivism is only 3%, it's really hard to find a treatment effect that could be powerful enough to, and samples large enough to go from 3% to 2%. So an implication of this, if you're treating juveniles who sexually offend, there's usually a focus on the sexual component, but that what also should be included, again, is treatment for general recidivism and methods described by Lipsey, which also include pro-social treatments addressing pro-social reasoning delays. And what I wanted to describe is a couple of studies on juveniles who sexually offended and them receiving pro-social interventions. One study that I was able to use is something called aggression replacement training. This is an intervention that promotes pro-social reasoning in adolescents. And it has a very good research basis. And hold on just a second. I realize there's workmen right outside my window. Sorry, folks. Let me just, because they're banging. So I do apologize. I'll be right back. Sorry about that. Sorry about that, but they're deciding to do work on our house just during this presentation. Who would know? So there, I'll be a little more relaxed. So this is aggression replacement training is a method to increase pro-social reasoning in adolescents. And I was able to do this with a couple of samples of kids who sexually offended. It's a wonderful method, but has limitations. It requires 30 sessions in a group. And the only place I know you could do that was in residential treatment with adolescents. Any of you who work with adolescents, oh my gosh, just getting them to show up is a major achievement. And having 8 kids show up in a group for 30 sessions on an outpatient basis, that would be truly amazing. So aggression replacement training, based on wonderful research regarding moral development, social learning, and significant research, including being a model program for the United States Office of Juvenile Justice. So I was able to do 3 studies actually with aggression replacement with juveniles. This was actually the first study and the only study I've seen using this method with that population. Again, these are samples, convenience, small n, but let me just tell you, it's really hard to be able to find these populations and do research with them. I did a 2009 study, again, a small n of 19, but it was randomized, showing there was a benefit to using aggression replacement training. I followed up with a 2012 replication, where we included actually a production measure of pro-social reasoning, and able to show increases in that with this intervention aggression replacement training. One of the smart things I did, or lucky things, let me say lucky, I did a qualitative focus group with youth after the intervention, and said, gee, did you get anything from it? What were the pluses? What were the minuses? And able to do focus groups in the 2009 and 2014 study. What I was able to show is that in both those focus groups, the youth basically said the same thing as aggression replacement training helped, and these were all youth in residential treatment for sexual offending, helped them reduce emotional reactivity and make pro-social choices. And a term that some of the kids would use, it helped me check myself before I wreck myself. We're able to do a third study, and this was a longitudinal study of the same treatment facility. Some of the youth had been through aggression replacement training, some hadn't. There didn't seem the youth in terms of selection other than the time they're in the program. When we looked at that and looked as a factor of them participating in aggression replacement training, we found that youth who participated in aggression replacement training had 1/4 the odds of sexual acting out in the program. And to me, that was, again, sample of convenience, one study, but again was suggestive that perhaps aggression replacement gave these youth some skills, even though aggression replacement training doesn't have anything specifically connected with sexual behaviors. It gave them some pro-social reasoning skills to stay out of trouble and not sexually act out in programs. Aggression replacement training is a great model if you can use it, but again, the limitations of 30 sessions in a group, and the group has to be the same throughout treatment, motivated me to think about, is there another approach that might be developed? So I developed a treatment model called Being a Pro, which used elements from aggression replacement training and other treatment approaches. This is a workbook published by Safer Society Press. I'm the author, but let me say I have no financial interest in the publication. Any proceeds are donated to the Safer Society Foundation. It's a nonprofit to prevent child abuse. So I just want to do the disclaimer that I don't have a financial interest in this. And it's a workbook model. And the basic model, and it's interesting, there are parallels with mindfulness, but the model I have is psychological and developmental research, is basically 4 stages that we teach the youth, and then have them do work on. Its first part is stop and think before acting. In other words, check yourself, don't wreck yourself. Then problem, figure out what's going on in the situation. What's the gist of the situation? What are the ends, means, thinking, cost, benefit? What's going on with other people? Choices then, well, given all that, what are your choices? And last part is review, be able to review the outcome and look for improvements. First 5 sessions, we teach the model. Next 5, we have the youth apply the model in real life with continued review and drill using this model. And this is part of what we do in our San Francisco program as part of the curriculum, along with other more sexually focused curriculum with the juveniles who sexually offended. We use some written vignettes, like, for example, what would you do if you found $200 in front of a bank? But also examples like this. And it's using pictures like a thematic apperception test, but using it for treatment. So I'll present youth with a picture like this, then ask them certain questions and to look at their thinking. What happened before? What's going on now? What are people thinking and feeling? Any rules or laws that apply? And what's the outcome? And in each of these situations, what you're trying to do is have the youth consider one more option or perspective in this. So wherever the kid is, you're trying to promote their, from a Piagetian point of view, increased development and perspectives and thinking about the world, other people, and consequences, and nudging them in a pro-social direction. You're not trying to have the youth go in a particular direction just to consider one more pro-social alternative. I was also able to do some modest outcome studies with this model. First was a sample of n equals 24, and the second was n equals 14. Let me say there are a lot of methodological limitations to these studies. These were simple pre-post test interventions without even a control group. But again, these are really tough populations to get access to. And I wanted to see, could we demonstrate some treatment effect from this intervention? First study I had was able to show 3 of 3 counselor rating scales showed pre to post changes, 1 of 1 youth measures, and then 1 of 2 performance measures where we're getting actually a sample of kids thinking. I thought that was really important, that if you have a intervention to promote pro-social reasoning in juveniles who sexually offend, shouldn't you be able to demonstrate some gains or in their level of pro-social reasoning? And we're able to do that with 1 out of 2 measures. Second study we did was and used only the counselor ratings and look at pre to post test changes. And we found that changes can be summarized from pre to post as increasing cooperation with adults and rules, promoting emotional control and regulation, resistance to peer pressure, and planning and thinking ahead. So this was counselors rating the youth before and after treatment. And I at that point hadn't been aware of Steinberg et al.'s model of psychosocial maturity that they used with those 1,300 youth with serious offenses. And the changes I saw almost exactly paralleled what Steinberg and colleagues found, which was, again, interesting. So a lot of limitations with these studies, a lot of similarities, but again, I think on whole, it certainly merited further research and helped me to understand the type of work I was doing, even modestly. So that's pretty much my presentation. And I think we have more than enough time for the question and answer. And maybe we can transition to that. And again, sorry for the distraction of people hammering outside my window. Who would have thought?
So Dr. Norbert, there's been a few questions that have come in, and one of them, I'm going to group them. Some of them are about measures, like what was the measure for using what was the pro-social measure used in the studies? I think you gave
2 measures. One was the pro-social reasoning outcome that I described, but also there's an older measure that the Washington University sentence completion test was developed by Jane Lovinger. It's actually a very good measure, and it measures Kohlberg type moral or ego development in youth. So, and it has good psychometric properties. That was the second measure. That's the one that actually showed the changes in the being a pro outcome study, and the pro-social reasoning outcomes, the one I didn't show the outcomes for that.
And what were the ages in the aggression that study, the art study? What was the age group?
I'd have to go back. The original study is something like 14 to 17. These are youth in residential treatment. Mean age is about 15.5. So you figure there's kind of some kids 14, some kids 16, a few 17. That's the age range. And these youth were all court ordered, mainly by probation, a few by social services, into residential treatment for sexual behavior problems.
Okay, thanks. And how about do juveniles who sexually offend, whose brain mature, have less sexual offending as adults than an adult sexual offender who doesn't have a positive juvenile history?
That statistics I don't know. The information I do know is most juveniles who sexually offend don't go on to be persistent offenders, that 3% rate. Now, the other question's a good one. I just don't know the statistics on.
And at what point does the youth become labeled according to Jessica's law? And is there a difference in labeling according to the Department of Justice or not?
I'd have to, I'm not, there's a couple of laws. I think I'm not, those aren't used as I recollect in California. And again, I'd have to review the specific law. There's a couple of named laws. Those basically aren't implemented in California as far as I know. But again, I'd have to do some research. I can't give an authoritative answer on that. Sorry.
Okay.
Just to let you know that the only way a youth in California can be registered as a sexual offender is if they go through the Department of Justice's program for sexual offenses. And that's a tiny, tiny minority of youth in California. Most youth in California aren't on a sexual registry. If you go to Alabama, for example, any sexual crime, and it could be mooning your school principal, end up in state prison and registered as sex offenders. So California is only a tiny minority are registered.
And people are interested on how, if you can give an example of how you work with parents. And there was a question here about same-sex versus different-sex siblings, children who are 3 to 4 years apart, and they're both under age 12.
Sure. Parents, I haven't included parents. Key thing we do is work with the parents while the youth are going through treatment. A wonderful guide to doing that, and it's free through Safer Society. Dr. Bonner provides like a workbook and handout for parents dealing. So this is having a sustained offense, and the parents dealing with it is a major stress for them. So it's a matter of support, education, and again, with the low recidivism, we can usually say, look, the worst is over. We're going to help you and the youth get through. And with current laws, most always the sexual offenses are sealed, which means from a legal point, they don't exist after the youth's completed treatment. So a lot of it's giving support and help to the parents to get through this, understanding there's things like a safety plan that you want to implement to make sure sexual boundaries and environments are safe for everybody. So those are things you work with the parent very closely. The second part of the question I didn't quite get. Could you repeat that?
So if you have two siblings, either same sex or different sex, and they're 3 or 4 years apart, but they're both under 12, how would you work with the parent and the children?
Yeah, I don't work. The term that's usually used is sexually reactive youth. my expertise is really limited to juveniles who are adjudicated on probation. So there's a whole, again, Dr. Bonner's group, and I also know Dr. Santiago, I believe your group, am I correct? Also works with that population. You have greater expertise.
A few, not that many, but yeah.
Okay.
Yeah.
And Dr. Bonner has a whole curriculum, evidence-based curriculum, working exactly with that population.
Right. You have to developmentally figure out, are they playing? I mean, sort of,
Yeah.
playing, teach, what was the,
Yeah. So that's beyond my expertise. I can point people in the right direction, but it's not something I do.
And what was the other question here on this list? Let's see. Can you talk about the risk of ADHD?
Yes, that's great. So ADHD, kids who have ADHD versus don't, their risk of recidivism is about 3 times as high. There's actually fairly decent data about that. So, again, you want to treat the comorbidities of a kid coming in. So if a kid has a youth has a prior diagnosis of ADHD, you carefully want to review with parents what the treatment options are and work with them around that because it is a significant risk factor, among others, for recidivism.
Yeah. And people want to know where they could get the Bonner book.
The Bonner book, you can, Safer Society Press, if you go on their website and do a search or call them, it's a free download for working with parents. So that's one of the nice things they have. And they'll be, if you search the website, I think you can find it. If you're really stuck, you can phone their number and they'll guide you through it.
And are there any overarching themes or when you're working with these kids that you see any overarching similarities of bringing in social factors or environmental factors? Or
I didn't get into it this presentation, but there are 2 typologies of these youth. One of the youth has more same age victims, like it's a boy with a same age girl and they're on a date and he ends up going way too far and commits a sexual assault. The other group, and those have more of a delinquent profile, those youth, versus juveniles who offend against younger age children, 4 or more years younger than they are, who tend to have a different psychological profile. So that they're those 2 typologies of youth, and your approach with those youth depends on the characteristics, including those typologies. And I'm sorry, there's part of the question I didn't answer. Could you just remind me of that?
I don't remember where.
Okay, well, I hope I answered the question.
The sibling one, I think it was the one you were talking about, the overarching themes about that you see in this environmental or social factors that you see in the population you work with.
Yeah, so the other thing is, like, even if you did the crime, it's very traumatic to be in treatment and go through the process. So a lot of what I'm doing is supporting the youth and having to deal with this and to also try to give them some sense of optimism. Cultural and family factors are very important. Understanding family structure and trying to support good choices for the family is always a challenge. And understanding how this plays out, given the patient family's background, how their particular ethnic group views that, and trying to support them from their perspective, and helping them navigate through this very challenging legal system.
I think there was a question if you saw any difference between biological and non-biological siblings.
With victims?
Yeah. The whole thing, perp and victim. Mm-hmm.
Yeah. There is some literature saying that youth who offend against younger male victims are at higher recidivism. Now, against like cousins or step siblings versus biological siblings, I don't know describing factors related to that. I mean, a key thing is that most of these youth I would say more than 95% or more, even if they offended against a child victim, don't have pedophilic interest. It was an available victim, someone they could control. And that's a key factor. Even though they offended against younger children, the great majority of these youth don't have fixed pedophilic interests. So,
yeah, all right. And people want to get a copy of the slides.
yeah. So what I'll do is I'll forward that to the Miss Martinez and make those available to her if that would work. And she can just, I'll make a PDF and she can distribute.
All right.
And I'm always happy to ask. I'm on the DPH email. Most of the articles I've cited there are available on my modest website for download. And always happy to talk with people offline. But my expertise is around youth who have sustained sexual offenses. There are a lot of youth with sexual problems that don't quite fit into that category.
Yeah, a lot of chaotic boundaries.
Yes.
We see more with the others. There's more chaotic boundaries and stuff.
Yes, ma'am.
I think that's everybody. I think everything on the chat all the questions that I could see, I try to group them.
Okay.
I want to thank you for your
Okay.
wonderful presentation and your time. We appreciate it.
Well, it was a real pleasure, and I hoped I gave folks some ideas about thinking about the field. Again, it's been a major change from focusing on the sexual disorder to like a more developmental and more holistic view of these youth and their functioning and sexual.
So there's still some questions about Jessica's law. I don't know, let's see, what time is it? We got, well, we're up at 9:29, but there's some question about Jessica's law and that it is in California. So I'm not sure. Maybe offline we can.
Yeah, I don't have expertise. I'll defer to someone else who would know more about that. It doesn't impact my work significantly in that it doesn't come up, which is reason for my ignorance of it. So
is that you think more San Francisco County or is it more California in general?
Around Jessica's law?
Yeah.
I really don't know. I confess ignorance of that, and I'm just kind of guessing, and I think I'm probably, I can't really answer authoritatively questions on that.
Okay. All right. Well, thank you so much.
Pleasure. And thanks, everybody. Have a great day and be safe out there.
Okay.